Sarah, what are some pretty common skin lesions that you are finding in your practice with your patients?
Yeah, I would say the most common are things like milia, which are benign lesions, nothing to worry about. But patients or clients often complain that they look like little pimples, but they just can't get them out and they just can't pop them. And that's because you're right, you can't. It's almost like a little pearl underneath the skin. And really, one of the most common ways to get them out is to break the tether that's holding those down underneath the skin, and then be able to pop them out. And they do, when they're released appropriately, they come out like these little mini pearl balls. They're really cool. It's really satisfying. So I would say that's pretty common. Another one that I'm seeing in some of my older clients that's pretty common are called sebaceous hyperplasia, which is also typically just a benign lesion, most commonly, but just an overgrowth of the sebaceous unit. And they look like, I would say the most common way to describe them is it looks like kind of like an overgrowth of skin, but a lot of them have a little dimple right in the middle. And that's that sebaceous unit, or that sits right in the center. So those are pretty common.